It's the kidneys. For human beings, they're essential to survival. In fact, the kidneys are small biological marvels.
Men, on the whole, need to take a more sensitive approach as visiting a doctor at least once a year for medical checkups. Because they're 90% male with renal failure than females. I'm Nurse Olive Sinclair. I'm an RN, nurse manager, director and CEO of Biomed Energy and Dialysis Inc., where we run or operate 2 dialysis units and also supply the consumables for the dialysis services to other dialysis units.
An artificial kidney is a device which is used to remove nitrogenous waste products from the blood through the process called dialysis.
Dialysis is a life-saving procedure that is done to patients or for patients with both acute and chronic renal failure. Dialysis replaces about 20% of the normal kidney function by removing the impurities from the blood and removing the excess fluid from the patient's body.
It has to be carried out until the kidney is replaced with a new one. Transplantation is a major operation through which a failed or dysfunctional kidney is replaced with a healthy one.
The number one cause of renal failure is diabetes, and where we have about 60% of the patients on dialysis or with renal failure are diabetics. Then there's hypertension. There's also some hereditary conditions such as polycystic kidney disease. We've had patients with acute or temporary renal failure, which would have occurred from drug overdose, poisoning, especially snake bite.
They produce urine, thereby removing excess water and toxins. Produce hormones, regulate mineral levels and blood pressure, make vitamin D, and maintain the body's acid-base balance. Every day, these versatile organs cleanse all the body's blood about 300 times.
I'll deal with the healthcare professionals first. Most of the patients don't turn up to the doctor until their severe signs and symptoms. So then it's hard on the medical system or the support staff to take care of them. On the patient side, some patients literally refuse to accept their condition. They literally refuse to follow instructions when it comes to their diet and their medication, and even having the dialysis procedure done as recommended.
To prevent toxins from accumulating, the blood must now be regularly cleansed with the help of dialysis. The most widely used form of dialysis therapy is called hemodialysis. At the center of hemodialysis is a dialysis filter, known as a dialyzer. Serving as an artificial kidney, it cleanses the patient's blood during the treatment.
BEDI, or Biomed Energy and Dialysis Inc., we are looking at improving the services, and that's why we have acquired 2 new machines where it doesn't only do dialysis for a patient with a double access. We can do dialysis for patients with a single port access, or let's say 1 needle. The dialysis machine can also perform different dialysis procedures for the patient.
Chronic kidney failure afflicts more than 3 million people worldwide. Most require life-saving dialysis treatment.
What I would like to see is all the regional hospitals having the support system for providing hemodialysis. At the same time, there should be a pre-workup clinic where patients can just have routine blood work done, and if the need arises, then they refer for further management.
It is a process or procedure to eliminate excess salts and nitrogenous waste from blood. It does not absorb or secrete anything. During dialysis, the patient's blood from the modified blood vessel in the arm is passed into a dialysis machine and returned after being cleaned.
The lifestyle changes, I would say, is diet and exercise, and at least an annual checkup with a primary care physician, having blood work done generally, not only for your kidneys, but for your heart, for your liver, because those underlying conditions could lead to renal failure in years to come.